Hi, I'm Nadine McCauley, and I'm the Manager of Volunteer Services at South County Health. During this brief video, we will touch upon some hospital policies and initiatives and go over some important information before you begin volunteering. Thanks again for giving your time to South County Health. Our vision at South County Health is to forge extraordinary connections with our community that support health at every stage of life. As a volunteer, we'll be guided by our hospital's values and will provide support and assistance and compassion to patients, staff, and visitors. A few examples of living our values at South County Health are creating a culture of trust with our patients and team members, speaking positively of our organization, physicians, team members, and fellow volunteers, holding customer information strictly confidential and keeping confidential materials away from public view, listening and asking questions sincerely while encouraging internal and external customers to express their needs, concerns, and ideas, treating patients, visitors, fellow volunteers, physicians, and other team members with consideration, valuing team members' contributions by always saying thank you, looking for ways to improve our customer service, outcomes, and costs for the organization, maintaining superior levels of customer satisfaction. Here is some information about the 4 entities that make up South County Health. South County Hospital's primary service area is South Kingstown, Narragansett, Charlestown, and Westerly. South County Health has a comprehensive network of medical professionals to provide a continuum of care for all patients. South County Surgical Supply, located in the Salt Pond Shopping Center, a retail provider of medical equipment. South County Home Health, founded in 1905, caring for post-discharge patients. Quality and patient safety. South County Health is dedicated to providing the highest quality care in a setting mindful of your safety and privacy. We are honored to be continually ranked #1 in patient satisfaction in the state of Rhode Island. To assist a patient with a complaint that cannot be solved by you or your supervisor, please reach out to the Quality and Performance Improvement Office by dialing 0 and asking to be connected with that office. Highly reliable organization. HRO is a program certification rolled out by the Hospital Association of Rhode Island. Hundreds of patients are entrusted to our care. Caring for others is a responsibility we take very seriously. The safety of patients and employees has always been a priority at South County Health. This initiative, Rhode Island Saves Lives, is about sharpening our focus to create a culture of safety, adopting and integrating shared values and beliefs about how we act and interact so that we can make our organization an even safer space with fewer human errors and fewer events of harm. We've selected these behaviors in consultation with experts from other industries like aviation and nuclear power, where they have been successfully used to reduce errors and accidents. So these are our safety behaviors based on our data selected by us to fit our culture. 5 simple safety behaviors: speak up for safety, attention to detail, validate and verify, effective communications, and stop in the face of uncertainty. Volunteer services will be focusing on a few of these behaviors. Self-check using STAR. Trying to save some time or rush through a task when things are busy may seem like the right thing to do, yet this seemingly safe move may lead to an unintended error. That's one reason why you should take a few seconds to focus on the details at hand using STAR safety behavior. Stop, think, act, and review. Stop is the most important step. It gives your brain a chance to catch up with what your hands are getting ready to do. For information to be transferred effectively, it needs to be clear, complete, and accurate. It also needs to be both sent and received. In the three-way repeat back, the sender initiates the communication. The receiver acknowledges the information by repeating it back. The sender then acknowledges the accuracy by closing the loop with the phrase, "That's correct." Patient identification reminders. When checking in a patient, use the following guidelines to identify a patient. While greeting a patient at a check-in desk, please ask the patient their first and last name and their date of birth as a second patient identifier. When on a unit, if a patient is not wearing an ID bracelet, please report it to a nurse manager right away. If the patient is wearing an ID bracelet, verify with the patient by asking them to read the name off the bracelet. Never remove a patient's identification bracelets. ID bracelets will not be removed until the patient is outside of the hospital. Next, let's go over some volunteer services standard practices. For customer service, hospital holidays, schedule and time commitment, dress code, and cell phone policy. When you encounter someone that appears lost or asks for directions, please offer to personally escort whenever possible. Wayfinding in hospitals can be very frustrating. Our hospital is known for their warm, friendly atmosphere. What is the 10-4 rule for friendliness? 10 feet away, make eye contact and smile. 4 feet away, say hello. What's the best way to communicate with our patients and visitors? The ADIC communication model. ADIT is a patient communication tool that stands for acknowledge, introduce, duration, explanation, and thank you. Always thank the patient or the visitor for choosing South County Health as their healthcare system. South County Health expects consistent and reliable service from its volunteer team. Please respect your team leaders by showing up for your shift on time and staying for the period that's assigned. Volunteer dependability is essential to effective performance. Please provide advance notice of planned vacations to your supervisor or department manager. It's also helpful to attempt to get replacement volunteers to cover you while you're away. Reach out to your supervisor for a list of replacement volunteers who are trained in your area. Volunteer Services is a 7-day-a-week department, which means staff members are available to assist you daily until 8 p.m. Surgical services and other departments are closed on major holidays below. However, volunteers with placement areas in the emergency room or inpatient areas who are available on holidays are welcome to report to their assigned areas. Please see below a list of holidays. Cleanliness and personal neatness are especially important in the healthcare setting. Volunteers must follow proper dress code by wearing their uniform and ID badge at all times. The badge must be worn at or above chest level, and badges must not be defaced in any way. All clothing should be tailored to ensure that they are not too short or too revealing. No denim or shorts. Shoes must be closed-toed and non-skid in patient care areas. In healthcare, we must consider the sensitivities of those around us. Be mindful that strong odors, including perfumes, are unacceptable. South County Health is a scent-free hospital. Please respect our patients by keeping your cell phone in your pocket while you're at the hospital. If you'd like to use your cell phone, please go into one of the common areas on your break or let your supervisor know that you'll be taking a call outside the hospital. At South County Health, all emergencies and codes are announced over the loudspeaker, followed by the location of the emergency. If you have an emergency to report, need security, or feel that there is imminent danger, please dial our emergency line, 1511, from any hospital phone. Code Red, Fire. The first 2 or 3 minutes of a fire are critical. The RACE formula below will help you respond effectively. Do not evacuate if the fire isn't called in your area. The hospital has fire doors to stop and contain each unit for safety. Take note of the fire exits and extinguishers nearest to your workstation. Assume every fire alert is real and ask visitors and patients to remain in their area and do not pass through fire doors until the all clear is called. You will receive an emergency badge to hang behind your volunteer ID badge when you begin volunteering. This badge identifies all emergency codes for your reference. Parking policy. Volunteers can park in any lot. If you are parked in the helicopter lot and a helicopter landing is announced over the loudspeaker, please move your car immediately, or it will be towed upon helicopter landing. Smoking policy. The use of tobacco products is prohibited on hospital campus and property owned or leased by South County Health. Infection prevention. Hand washing is the #1 way to keep our patients and staff safe from harm. Please use soap and water to wash hands. Our policy at South County Health is to foam in and out of every room and every patient care area. Please follow this policy. Some helpful tips on cough etiquette. When a patient is suspected of having or is diagnosed with an infectious disease that may spread to others, the patient is placed on isolation precautions. Volunteers are not allowed in isolation rooms for your safety. Confidentiality and HIPAA. The Health Insurance Portability and Accountability Act, known as HIPAA, is a federal law that protects the privacy and security of patient information. The law sets rules to protect patient information or protected health information, known as PHI. A few helpful reminders for volunteers regarding PHI. Dispose of all patient information by using the hospital shredders and never take information home. Turn off your computer screen if you leave the workstation, or never share passwords. Never discuss any patient information in hallways, elevators, or outside of the hospital, and report all abuses to your manager. Volunteers discuss information only in a private space and not in any public spaces in the hospital. All issues of concern will be shared only with the appropriate staff, and volunteers may not have access to patient charts. HIPAA says we must protect our patient information by properly signing in with our user ID and password, keeping IDs confidential, and never dispose of patient information in an open area trash bin. An event is any unusual occurrence, adverse reaction, negative response, or unfortunate event involving a patient, visitor, employee, or a fellow volunteer. Please report any unsafe conditions, patient or visitor complaints, or volunteer injuries to the volunteer manager. The Joint Commission is an independent, not-for-profit organization that accredits and certifies more than 1,900 healthcare organizations and programs in the United States, including South County Health. The Joint Commission accreditation and certification is recognized nationwide as a symbol of quality that reflects an organization's commitment to meeting certain performance standards. As a volunteer, it's important that you understand you could be approached by individuals from this or any other agency during their inspections. You may be asked specific questions regarding your volunteer position, and you should feel free to access a copy of your training materials that we provided for you, and an extra copy is kept at the patient information desk. Thank you for participating in our online volunteer training. Please take the short quiz located in the link below, and a confirmation will be sent to the Volunteer Services Department. As always, thank you for giving your time to South County Health.